Well, yes, that's what we focus on this morning for a start. And we're joined by Dr.Ibitrokoemi Korubo, who is the chairman, Nigerian Medical Association, Rivers State Chapter, and also the NMA chairman, South Forum. Morning, and thank you for coming on today.
Good morning, thank you for having me.
Well, speaking about this strike, yes, we'll come to the issues, but it does appear to so many people, in fact, when you come up with the notice or when you come up with that decision, the NMA now, about going on strike, you have people who ask themselves, wait a minute, how come it looks so easy these days for doctors to just embark on this strike? Because people would have thought the Hippocratic Oath would have forbade doctors from doing all of this, no matter what happens.
Well, thank you again for having me. Well, let me first of all start by saying that Hippocrates was jailed for 20 years. People don't remember that, for fighting the system to ensure that health itself was given its place. He was in jail for 20 years. So we need to put that in perspective. Now, the second aspect here is that most of the problems in the health sector have been going on for 25, 22 years. And the Nigerian Medical Association has spent the last 22 years trying to talk with government, interface with government to get us to where the health sector in Nigeria should be. And this strike today is a difficult decision we had to take. We are not happy about it. We are still talking with government, and we pray that government will see reason with us. Remember that this is a recommencement of a previously suspended strike. In November, we had a morning strike, and we divided our demands into two. We talked about infrastructure development. We talked about the need to have the Medical and Dental Council reinstituted, and so that we can monitor our practice.
But that has happened.
I'm coming. We talked about improving allocation to health. Remember, we complained that in Abuja 2000, African leaders came here and said 15% of our budget should be for health. Nigeria last year had about 6-point-something%, and now it has even dropped further by 6.7%. Now we looked at that also. Apart from that also, we talked about the need for universal health coverage. And of course, we offered solutions. We gave a roadmap to government to try to achieve this. Government hasn't listened. Right. In our demand also, we discussed about the need for professionalism. People need to come to the hospital and don't get confused with who is in charge of their healthcare. And we gave government solutions. Now, while we suspended our strike because of the call by Nigerians, government went ahead to implement things that government was fully aware would cause chaos in the system. And if you would permit me, I'd like us to have some basics first in our discussion. Now, the first thing I want to stress here is that to manage hospitals, hospitals are managed in two sectors: the management board and the executive arm. This is the first point I want us to use in the basis of our discussion. The second thing I want to say here is that there is need for equity and justice in whatever we do. We must come to the table with clean hands.
Does that suggest somebody is not?
I will mention that. Now, the third one also is when you are negotiating with somebody, negotiations break down when there's lack of honesty. You need to be honest with people you're negotiating with. Sometimes it's good to openly say no, and not to say I will do it and you don't do it. Now, let's start from the very beginning. In the current demands, remember that this is a continuation. So what we've highlighted now are the issues of professionalism. The fourth point I want to mention before we go into details is that patients walk into the hospital to see a doctor. The doctor requires a team to see the patient. The doctor recruits members of the other health professionals to assist him in looking after the patient.
Recruits?
Invites. Invites. I can see a patient, I'm a physician, I can see a patient and say, what you just need is dietary control, and you go. There'll be no lab investigations. There'll be no admission. There will be no drugs. So I am the one that says, look, you need drugs, and then the pharmacist is invited. I'm the one that says you need to do investigations, and I send you a sample. So now, and the key thing I must stress here is that the doctors have no quarrel with the health workers.
But that's not the way it's coming across.
Well, that's the mistake.
It comes across as though the doctors are open arms against their colleagues in that health sector.
The doctors have no quarrels with the health workers. In fact, even with the government, we have grievances, not quarrels. There are no quarrels. Now, if we go further, the way hospitals are managed in Nigeria, you have a management board. The aim of the management board is to ensure that the policy of government is carried out. That board can be chaired by anybody. We have FMC RUA chaired by a lawyer. Anybody. patient should be represented in that board. All health professionals should be represented in that board. The key thing of that board is you look after basic policies of government. That is to say, funding, budgeting, promotions are all done by the board. The doctors have no problem with that.
Okay, just highlight on this before I lose my train of thought.
Yes.
What is your grievance or the doctor's grievance with your colleagues in the health sector?
No, that's where I'm getting to now.
All right.
I'm getting to that now. So this is how the hospitals are managed. You have a management board. Even you, Chamberlain, can be made a chairman of the board. Follow the policies, follow guidelines, and that's okay. Now, the next step in hospital management is the executive function. Remember that the person that can understand the pharmacist, I can say, look, yeah, this drug is important, this may not be important, is the doctor. The person that can understand the lab scientist and say, yes, I think we need to manage the resources to give this particular kit or don't do that, is the doctor. The person that can understand with the nurse that, yes, you need this for nursing care and you need this for wound dressing and all that, is the doctor. And that therefore means that since the sole aim of hospitals is to deliver health care to our patients, that is the aim. Hospitals are not designed for politics, and it is to provide care. The person that has a relationship with the patient and has a relationship with all other health workers is the doctor. Therefore, common sense shows that in the executive function, the day-to-day running of the hospital, the person that bears the responsibility should be in charge. And that is why we have said, like it's practiced everywhere in the world, that the position of the chief medical director, which is the executive function, should be kept for the doctor. The management of the board, anybody can manage it. Abroad, you have hospital administrators. Those hospital administrators are at the management of the board. The hospital administrator cannot, let's imagine now, a pharmacy, let's say I have 100,000 naira. Because you know part of our problem in this country is poor funding. You have to manage limited resources, limited human resources, financial resources. I have 100,000 naira. The pharmacist comes to say, I need this. The lab man comes, the nurse comes. I am in the position to say this is a priority. Basically because I have a direct relationship with all of you, but more importantly, we keep forgetting that the relationship is with the patient.
But you do know, anyway, it also does come across as though these points that you've raised,
yes,
it's something that you don't have to force down the throats of the authorities to make them happen. Something that this is something you should lobby. You should make them see reason why that should be. And not when you go on strike, it looks as though, look, you're trying to force us to do these things you say are the right things to do.
Chamberlain, you see, remember I told you that there are issues in the health sector that have spanned 22 years. 22 years. Now, NMA has continuously engaged government. In the past, it is possible that the health workers have felt aggrieved, maybe abandoned by doctors in the past. And I frown against that. The current enemy believes in carrying everybody along. When we talk about relativity, Chamberlain, relativity just means that people are paid according to their responsibility budget. I have a higher responsibility at this level, and so I should earn this relative to the next person. Now, the beautiful thing...
Doctors want to determine that?
No, it is international best practices. It's not a Nigerian factor. We are not practicing Nigerian medicine here. This is what happens everywhere in the world. Now, the beautiful thing about relativity is this. You can't increase any sector's salary without affecting the other one, because relativity is maintained. This would also help the government in budgeting, planning, forecasting. Now, government decides to step in and tries to erode relativity for 22 years. And the doctor has constantly said, this is what happens everywhere in the world. In the US, in the UK, you had a training in the UK, so did Mobile. And I'm sure in the UK, you know, the standards are practiced.
Well, we do also know in the UK that, there are certain people are allowed to pursue their careers to the highest levels of professionalism. And what's your statement in terms of, doctors being at the heart of it all? What it seems to undermine is the fact that your colleagues are also allowed to be at the height of their professions. So when you begin to ask for things like, you cannot be a consultant this and a consultant
that. We'll get to that.
Only doctors can be consultants.
Let's get to that. First of all, let me say that.
We have to ask if that's world best practice as well.
Let me say this, that the Nigerian Medical Association promotes the fact that all health workers should reach the peak of their career. The health workers you're talking about are our wives, our brothers, our younger ones, our friends. In the hospitals, we don't fight. We need to, let's separate administration from practice. The nurse knows the doctor is there, the doctor needs the nurse. We all are friends, so let's not create a problem where there's none. Now, Mope, when you talk about professionalism and reaching your peak, certain terminologies indicate certain things. When you go to the hospital and you want to do an investigation, there's a column there for the term consultant. Now, in the medical field, the medical consultant, according to Wikipedia, not the Nigerian Medical Association, is a specialist physician or surgeon appointed to look after the patient. Now, the reason that was done, again by the UK, US, not enemy, was because patients come in and they consult you, they meet you for assistance. And at the end of the day, you bear responsibility. If somebody goes to the lab, do a cross match, for example, and the person gets transfused and he dies, who gets sued? I have never heard where any nurse has been sued. I have never heard any lab scientist being sued. I have never heard any pharmacist being sued. You sue the doctor. It's the same thing in the plane. Remember that you do not see the pilot in the plane. I don't know how many of us see them in local flights.
Are you saying that pharmacists and all other health professionals are not sued?
How many? I didn't say they're not sued. How often are they sued? The point, Chamberlain, I'm getting to is when you come to the plane, your baggage clearance, everything, your ticketing, up to the air hostess and the flight executives, most of the time you just hear the pilot's plane. But imagine a situation where you sit down and the air hostess says, ladies and gentlemen, welcome. Today I am captain of this plane. Something is wrong. The point is, everybody has their role. The air hostess cannot answer pilot. Everybody has their roles. The issue of medical course, the lab scientists and pharmacists have the right to answer specialists. They can reach the peak of their career, answer specialists, they can answer any technology. In the UK, there is no nursing consultant. They are called nursing practitioners. There's no nursing consultant. There's no lab consultant.
I have Googled and I've seen a nursing consultant before.
Well,
a consultant nurse,
most of them are called nursing practitioners. And let me remind you that the system in the NHIS was designed for where you don't have enough medical manpower, and so certain groups are trained to be an intermediary.
Which we also seem to have here. I mean, we have seen cases where, will you say then that we do have enough doctors? Let me
put you in the right perspective. Where we are talking about is a situation where in a village, for example, there's no doctor, and you have a specialist nurse there. The nurse knows her limits. She does a beautiful work, but she knows her limit and knows when to refer. You cannot have that in a teaching hospital or a federal medical center setting. For example, look at the issues of director. In the hospitals, the doctors have only two directors. The chief medical director and the chairman medical advisory committee. Now imagine if in my hospital, I am the director and my HOD is not the director. There will be anarchy and confusion. NMA says, please promote them to directors. Make them anything you want to. But by the time one is being made a director, that person has gained a lot of experience, has something to offer in policy. And you should be in the ministry, where you are promoting policies and all that. In the hospital setup, that causes confusion. You see, there is a need for you to understand NMA's stance. NMA has nothing against the health workers.